The lungs are one of the most vital organs in our body, playing a critical role in delivering oxygen to our bloodstream, which is essential for every cell's survival. Unfortunately, our lungs are constantly exposed to the external environment, making them susceptible to pollutants. Breathing in air pollution, cigarette smoke, and other toxins can cause significant damage to the lungs and lead to serious health conditions. For instance, cigarette smoke can settle on the bronchial tubes and alveoli, reducing breathing capacity, while inhaled carbon monoxide can disrupt the body's oxygenation process. To give you an idea of the impact, cigarette smoke is responsible for over 480,000 deaths per year in the United States alone, including more than 41,000 deaths from secondhand smoke exposure. This translates to about 1 in 5 deaths annually, or 1,300 deaths per day. Additionally, the World Health Organization reports that exposure to air pollution results in approximately 4.2 million deaths worldwide each year. This is why it's essential to protect the health of this vital organ. The good news is, there are some lung detoxification strategies that can help. Lung detoxification techniques can be highly beneficial for smokers, those regularly exposed to air pollution, and individuals with chronic respiratory conditions such as asthma, COPD, or cystic fibrosis. Which is why in this video we will explore how you can protect your lungs from further damage and introduce methods to detoxify them. We will also look at some foods and supplements you can incorporate into your diet to promote lung health. So keep watching to learn how to protect your lungs from further damage. While you can't entirely reverse years of damage from smoking, the best thing you can do to detoxify your lungs is to prevent further harm. The most effective action smokers can take is to quit smoking altogether. Although quitting can be challenging, especially for long-term smokers, numerous resources are available online to support smoking cessation. If quitting seems too daunting, reducing the frequency of smoking can still make a significant difference. For non-smokers, it is equally important to avoid secondhand smoke, as it can also harm the lungs. Using face masks in areas with high levels of air pollution can provide additional protection. The air passages in our lungs have microscopic, finger-like projections called cilia that play a crucial role in protecting the lungs from infection. These cilia, along with sticky mucus, trap bacteria and other pathogens as they enter the lungs. The cilia then move in synchronized pattern to push the mucus up into the airway and back into the throat, where it can be swallowed, and the pathogens killed by stomach acidity. However, continuous exposure to cigarette smoke or high levels of air pollution can impair the function of these cilia, making it difficult for them to clear the lungs of various particles, bacteria, and other pathogens. Therefore, to effectively detoxify your lungs and implement the other methods we will discuss, it is crucial to minimize your exposure to smoke and other pollutants. This will allow your cilia to function properly and aid in the recovery of your lungs. Another crucial step in maintaining lung health is controlling indoor air pollution. The quality of the air inside your home can significantly impact your lungs, especially for those with existing respiratory conditions. Dust, irritants, and chemicals can accumulate indoors, posing a risk to lung health. To improve indoor air quality, it's important to keep your living space clean. Regularly vacuuming with a high-quality vacuum cleaner can help remove dust and other particles from your floors and carpets. Mopping the floors also helps, but try to use natural, chemical-free cleaners to avoid introducing more pollutants into your home. Managing humidity levels is another essential aspect of maintaining indoor air quality. Dust mites and mold thrive in humid environments, which can aggravate respiratory issues. Using a dehumidifier can help keep the humidity in check, preventing the growth of mold and dust mites. Running exhaust fans while cooking can also reduce humidity and prevent mold buildup. Additionally, it is wise to test your home for radon gas, a naturally occurring radioactive gas that can seep into homes from the ground. Radon is a significant risk factor for lung cancer, so using a radon test kit from a home improvement store can help ensure your home is safe. Another way to improve indoor air quality is by going chemical-free. Opt for natural cleaning products and fragrance-free items, and avoid using aerosol sprays. These chemicals can contribute to indoor air pollution and negatively affect your lung health. Incorporating indoor plants like ferns, spider plants, or aloe vera can also help purify the air in your home. These plants can absorb pollutants and improve air quality. Additionally, investing in a good air purifier can make a significant difference. Look for purifiers that can detect air quality, and remove 99.97% of airborne pollutants as small as 0.003 microns. Once you have taken steps to reduce your exposure to harmful pollutants, you can focus on methods to detoxify your lungs. One effective technique is postural drainage, which uses gravity to help drain lung secretions. This method involves positioning your body so that the trachea is inclined downwards, allowing mucus to move from the lungs to the central airways, where it can be expelled. For instance, you can lie on your back with pillows under your hips, ensuring your chest is lower than your hips. Practice breathing slowly, inhaling through your nose and exhaling through your mouth, with each exhale lasting twice as long as the inhale. This technique can be performed for a few minutes in various positions, including lying on your side or stomach to target different parts of your lungs. Incorporating regular exercise into your routine is another vital aspect of lung detoxification. Just as exercise strengthens your muscles, it also strengthens your lungs and heart. Cardio and aerobic exercises such as jogging, cycling, swimming, or playing sports can significantly benefit lung health. These activities increase blood flow to the pulmonary vessels, helping to heal damaged lung tissue and improve overall lung function. Aim for at least 30 to 40 minutes of cardiovascular exercise 5 times a week to see the best results. Breathing exercises are also highly effective in enhancing lung capacity and function, particularly for individuals who smoke, have smoked in the past, or suffer from chronic lung diseases. Techniques such as diaphragmatic breathing and pursed lip breathing can help improve lung efficiency and oxygenation. Diaphragmatic breathing focuses on using the diaphragm to draw air into the lungs, promoting deeper and more efficient breaths. Pursed lip breathing involves inhaling through the nose and exhaling slowly through pursed lips, which helps keep the airways open longer and facilitates better air exchange. By incorporating these exercises into your routine, you can help your lungs recover and maintain their health. In the next section, we will discuss dietary changes and supplements that can further support lung detoxification and overall respiratory health. To further support lung detoxification and overall respiratory health, including specific dietary changes and supplements can make a significant difference. One powerful addition to your diet is green tea. Green tea is rich in antioxidants, which help reduce inflammation in the lungs and protect lung tissue from the harmful effects of smoke inhalation. Studies have shown that individuals who consume at least 2 cups of green tea daily have better lung function than those who do not. The anti-inflammatory properties of green tea can also aid in the recovery of lung tissue, making it an excellent choice for supporting lung health. Vitamin D is another essential nutrient for maintaining healthy lungs. A diet rich in vitamin D can improve lung function and reduce the risk of respiratory infections. Foods high in vitamin D include salmon, sardines, eggs, and fortified dairy products. Additionally, spending 10 to 20 minutes in sunlight each day can help your body produce and activate vitamin D. This nutrient plays a crucial role in immune function, which is vital for protecting the lungs from infections and promoting overall respiratory health. Antioxidant-rich foods are also beneficial for lung health. Nutrient-dense foods, particularly those high in antioxidants, can help neutralize free radicals that damage lung cells. Apples, for instance, contain a variety of phytochemicals, including quercetin and catechin, which are potent antioxidants. Red bell peppers are another excellent choice, providing abundant antioxidants, vitamin C, and carotenoids. Turmeric, which its active ingredient is curcumin, is renowned for its anti-inflammatory and antioxidant properties. Including these foods in your diet can significantly aid in lung detoxification and promote optimal lung health. Blueberries are among the best foods for lung health due to their high levels of antioxidants, known as flavonoids. These compounds help reduce oxidative stress and inflammation in the lungs, supporting overall lung function. Other antioxidant-rich foods to consider include green leafy vegetables, lentils, beans, grapes, walnuts, and garlic. These foods can enhance your body's ability to fight off harmful free radicals and support the detoxification process. In addition to whole foods, antioxidant supplements can provide an extra boost to your lung health regimen. Supplements such as vitamin C, vitamin E, and beta-carotene are known for their antioxidant properties and can help protect lung tissue from damage. Always consult with your healthcare provider before starting any new supplement to ensure it is appropriate for your individual health needs. By making these dietary adjustments and incorporating antioxidant-rich foods and supplements, you can further support your lung health and enhance the detoxification process. Remember, maintaining lung health is an ongoing process that involves a combination of lifestyle changes, environmental controls, and nutritional support. But as previously mentioned, protecting your lungs from further damage is the first critical step in lung detoxification. Quitting smoking, avoiding secondhand smoke, and reducing exposure to air pollution are essential measures. Improving indoor air quality by keeping your home clean, managing humidity levels, and ensuring natural cleaning products can significantly benefit your lungs. Techniques like postural drainage and regular exercise, including both cardio and breathing exercise, can help clear the lungs of mucus and improve overall lung function. Lastly, incorporating a diet rich in green tea, vitamin D, and antioxidants will support lung health and aid in the detoxification process. By taking these steps, you can help your lungs recover from past damage and maintain their health for the future. If you want to support the channel, please like and subscribe. I would greatly appreciate it. There should be some other helpful videos popping up on your screen right about now that I think you will enjoy. And just a quick reminder, we are not doctors. This video is for informational purposes only. Thank you so much for watching. Have a blessed day, and as always, breathe easy, my friend.